Okay, I would like to call the March 15th Human Services Committee meeting to order. First order of business is approval of minutes for February 15th. Do I have a motion?
So moved.
Second?
Second.
Okay, all in favor?
Aye.
Okay, motion approved. Is there anyone here for privilege of the floor? Anyone here for privilege of the floor? Seeing none, we'll go to our first proposed resolution, which is confirm appointments and reappointments for the Community Service Board. Is there anyone here to speak to that? Okay, well, seeing none.
Mr.
And-
Chairman, I just want to thank all these people for being willing to serve on this board.
Okay, yep, looks like a good group of people. All in favor?
Aye.
Aye.
Any opposed? Resolution carries. The second resolution is to amend the 2022 and 2023 budgets for grant revenue for mental hygiene. We have all right, if you could state your name for the public.
Carmelo Hernandez, Director of Mental Hygiene.
And Kathleen Dennison, Budget Director.
Okay,
And the way it was explained to me, and Kathy, correct me if I'm wrong, is that we had ordered some IT equipment in 2022. However, the money was not used because the equipment didn't come because of the supply chain issues.
Right.
So it's due to come in 2023. So we're moving to use the funding here in 2023.
Yes, yeah, whatever. Carmel is completely correct in all that. Why we need the resolution is that when that circumstance occurs at the end of the year, those open purchase orders, the expense budget attached to them automatically rolls into the new year. But in Carmelo's department, I mean, that purchase is funded by outside revenue, and the revenue budget doesn't travel with the expense budget. And since his department has they have a very low local share, so when that happens, essentially he's missing revenue in 2022. He can't get it because he didn't do the grant. He can't get the reimbursement. So it makes his 2022 results look artificially poor. And so this resolution will correct that imbalance in the revenue budget. Because I say right now in 2022, the revenue isn't there, and and it needs to be in 2023. So that's what this resolution does.
okay. Any questions from the committee?
So the bottom line is no real change to the bottom line.
Correct. Because it's not written into the resolution. Technically, the amendment to the 2022 budget uses fund balance because we're decreasing the amount of revenue that we have budgeted. It's a use of fund balance. But then in 2023, it's a contribution of fund balance. We have revenue with no expense attached to it. But yes, what you said is correct. It has no, it's just a timing issue. There's no bottom line detriment or advantage between the 2 years.
Okay, thank you.
Or once the 2 years are considered together, there's no use of fund, no net use of fund balance, no net change to local share once you consider the 2 years together.
Billy? Anything? So these purchases are now made?
We're hoping to receive them.
They might not have been executed yet. I mean, that
So this
purchase
is
order, it's in 2023.
Okay.
It stays open and active until the equipment is
Hopefully
until it arrives.
Arrives,
Yeah.
okay.
Yeah. And then once it arrives, then the department can make the request for reimbursement, get the revenue attached to that purchase.
Okay. All in favor?
Aye.
Opposed? Most resolution carries. Resolution number 3 is to amend the 2022 budget for year-end reconciliations for social services. Oops, I'm sorry. For the record,
Good. For the record, my name is John Anderson, Deputy Commissioner, Social Services.
still Kathleen.
Still Kathleen.
Oh, yeah.
Okay.
Yes, sure.
Well, similar to what Carmelo said, I'll let Kathleen add any particulars here, but this is basically the explanation for this came last month as far as resolution goes. And this month, because it was too soon to have all the actual dollars accounted for, this month is actually making it a true reconciliation of that, as I understand it.
Yes, and we did do some budget amendments in February to the Department of Social Services budgets, but in that department, a lot of the transactions that are done with New York State and with the federal government, a lot of the revenue comes in very late, and some of the expenditures that we are asked to make also come in late and just don't make the deadlines for the February amendments. So the department typically makes as many adjustments as it can in February, but we always have some that lag that process a little bit.
Yes.
And as you can see, it is balanced between appropriations and revenues. So there is no effect on the local share.
It's always good.
Yep.
Any questions?
Yeah, how do you decide with the revenue accounts, how much, how do you find a balance between these two?
A lot of, because I'm looking to see if they are exactly balanced, and they are. You mean the split between the federal and the state?
Yes.
That is, it's based on, with all of these programs, there is typically, John probably knows better. Yeah, there's a set designation between federal contribution and state contribution.
Local share contribution. Yeah. So based on the expense, then you would have a revenue side that would be equal to that proportion.
And
but
so
they do vary.
You move them around to make sure that there's a balance, or how?
You mean as far as the 395 and the 395,
yes.
967, that is more a budget question, I think.
Well, if you look, for example, in Department 6055, it's the first appropriation one, we had a late expense for daycare, but had the corresponding revenue to cover it. And it's split between the federal and the state just based on their contributions to that endeavor. Does that make sense?
Okay.
And a lot of, in this department, there are a lot of accruals at the end of the year and that means when we are finalizing 2022, we've done a lot of work, but we don't always have invoices from the various agencies. So we are we don't get them timely. And so we have to wait until we get notification of what our actual expenses are. And so we typically, it happens more with the revenue side, that at the end of the year, we know what work we've done, we know what costs are incurred, but we don't have the revenue. So we're making an accrual, which is we are making an estimate of what revenue we will receive. But we earned it in 2022, so we recorded in 2022. So that is going on all the time, particularly in social services. But also in that arena, there's just a lot of invoices for services rendered that just don't come timely. And so when they show up on March 1st, we know that it happened in 2022. So we're recognizing that expense in 2022. And in most cases, revenue comes with it. So we recognize the revenue as well. So it is balanced, but just late.
Mr. Chairman, perhaps I can assist with answering Legislator Rankin's excellent question.
Okay.
If you look at the categories don't exactly match up. So the additional expense for safety net is greater than the additional revenue for safety net. What you have to bear in mind is that to balance the budget, we don't have to use the revenue from the same account to balance the over expenditures in that account. So if the expenditures, the appropriations are over budget, we can take any account that has revenues over budget and use that to balance. It doesn't have to match dollar for dollar, safety net to safety net, family assistance to family assistance. Okay?
Okay. Yep. Thank you.
You're just taking it from one account and putting it at the other just to make it balance out.
Right. In total, it balances. We have enough additional revenue over budget to balance the additional expenses over budget.
Yes, and in the case of this resolution, some of them are balanced within the particular department, but as Chairman Chagnon indicated, they don't have to be within the exact department. Doesn't have to be a one-to-one correspondence.
I mean, I totally trust your numbers and what you're doing. I just didn't understand the difference, and so that was helpful.
Okay.
So thank you.
So you said that we might not, we generally get the revenue late. Like
Yes,
now.
it's
But we
paid
know the
late.
It's paid late.
It's
but we
paid
know
late.
the revenues come and the
Yes.
commitment is there.
Yes.
Right.
But the expense side of it.
A lot of times that's late too.
We don't get the invoices from the,
That's right.
is there any way, I mean, is that a pain in the butt for you? or-
Yeah.
Yes. Yes, it is. Yeah, yes, it is.
Sure, right.
Yeah.
You need to work on this.
Yeah, I mean,
Yeah. Can we lean on them a little
I don't
bit?
know. I mean, the best example is the state training school,
Mhm.
where we're getting invoices now
Years.
from like 2020,
Years.
if we're lucky.
Several years ago.
Yeah, years.
And yeah, and we do hear that we should, we put pressure on that particular one, but we have others that we do put pressure on to get invoices in more quickly.
But
don't-
I give a lot of
That's a
credit. I
balance.
mean, I give a lot of credit to the fiscal unit in social service, health and human services, because those, any accrual, well, I shouldn't say that. Most accruals, they're estimates. Sometimes you have an exact invoice. It just came too late to be processed as a 2022 invoice. So in
Yeah.
some cases, you know exactly what the expense is, so you make an accrual to match it. Same thing, and same thing happens with revenue. You receive the check on February 5th. It's too late to actually record it in 2022. So you make an accrual estimated, but you know exactly what it's going to be. But there's a lot of other cases where you have to make a very educated guess on what the expenses are. Like say with state training school, we don't have invoices for several years.
We might not know the rate they're charging
Yeah.
for that particular. Yeah, there's all kinds of situations with that.
Yeah. So they have to make a very educated guess on what expenses we incurred, but
Right.
have no documentation for. And the same thing on the revenue side. But I say to their credit, they're very accurate.
Just interesting that they won't invoice you for
Yeah.
years in
Very
some
strange.
cases.
Yes.
Yeah.
Yes.
I'm not used to that
Strange
being in the
and-
private
yeah.
sector.
Yeah. And as you say, yes,
It wouldn't work.
and it's not, it is not a desirable or an easy thing to deal with.
Okay. Any other questions? Concerns? All in favor?
Hi.
Any opposed? Motion carries. Thank you.
Thank you.
Okay. Now we have a discussion from Carmelo.
I could tell by her question, she was looking at the fine detail.
Thank you. Sorry, pen.
Oh.
Thank you. Sorry about
That's all
that.
right.
Oh, Thank you guys for having me. Carmelo Hernandez, Director of Mental Hygiene. And here for discussion today is three great opportunities that our department, Rachel Lutwick, Trish McClendon, the whole department really, Kathy Swanson, are working probably right now in submitting these. So we are applying for three different grants. And I'll here to give a brief description and what they are and the population that we'll be able to serve if we're able to get all three. We're shooting for all three, but even if we land just one of these, it's going to make a huge impact within our community. The first one is Project Launch, and that's from SAMHSA, the Substance Abuse and Mental Health Services Administration. And the purpose of this grant is to promote wellness of young children from birth to 8 years of age by addressing social, emotional, cognitive, physical, and behavioral aspects of their development, as well as prepare them to thrive in school and beyond. The awards will also provide local communities or tribes resources to disseminate effective and innovative early childhood mental health practices and services. With this program, SAMHSA aims to promote resilience and emotional health for children, youth, and their families. Good news is no local share impact if we were able to get this. Will new employees be needed? No. Will subcontractors be used? No. Will additional office space be needed? No. So this would be 100% to implement within the population that we're targeting with this grant right here from SAMHSA. SAMHSA also has another grant that they're putting out as well, and this one is SAMHSA and also the Center for Mental Health Services, and this one is called AWARE. And if awarded, Chautauqua County Mental Hygiene will leverage our partnerships to implement mental health related promotion, awareness, prevention, intervention, and resilience activities to ensure that school age youth have access and are connected to appropriate and effective behavioral health services. With this program, SAMHSA aims to promote the healthy social and emotional development of school age youth and prevent youth violence in school settings. Once again, local share, none. New employees, no. Subcontractors, no. Additional office space, no. And the final grant here is System of Care. The purpose of this program is to provide resources to improve the mental health outcomes all the way from children from youth, birth through age 21, at risk or with serious emotional disturbances, SED. This program supports the implementation, expansion, and integration of the system of care approach by creating sustainable infrastructure and services that are required as part of the Comprehensive Community Mental Health Services for Children and Their Families program, also known as the Children's Mental Health Initiative, or CMHI. With this program, the aim is to provide mental health services to children and youth from birth to age 21 at risk for or with serious emotional disturbances and their families. Also to prepare children and youth at risk for with SED for successful transition to adulthood and assumption of adult roles and responsibilities. Once again, no local share impact, no new employees, no subcontractors, and no additional office space. This grant specific right here is a 4-year grant. If awarded, it's a $4 million, $1 million a year for the System of Care grant. For the AWARE, it is a 5-year grant up to $1.8 million per year. And for the launch grant, it is a $4,800,000 a year for 5 years.
4,800,000 per year.
4 million total. Sorry, 4 million total, and it'll be 800,000 a year for 5 years, if awarded. So our goal is to land one of them, but we applied for 3 just because of the simple fact of how we know we can utilize it and implement it. The team has been working tirelessly. They've been working diligently. We saw them when they came in. We were a little bit hesitant to apply, just trying to really figure out a strategic plan on how to utilize and implement it. And we figured let's apply for all 3 and hopefully land one. And big man upstairs looks out for our county. We'll be able to land all 3.
So you're going to implement them through the schools, obviously, and
That's the goal.
With no added staff or anything, just the teachers and the counselors, and
That's the goal.
really, well,
That's the goal, especially with the early intervention and up to the age of 21, which help us out with that gap, especially in the transitions. So hopefully to provide more resources, more training, and to really just build the infrastructure. One thing that I did ask Office of Mental Health, and I'm waiting to have a meeting with them. I remember, well, it's currently happening, the fellows, the fellowship corps that public health was able to get. And my ask of them was, hey, this is pretty cool because I know you guys are trying to build a workforce, especially what happened with the pandemic. I said, I don't know if we realize it yet, but mental health is like 2.0 of outcomes of what happened during the pandemic and substance use. I said, what if we had a fellowship program for mental health and to develop our workforce? And they were interested, and it was ironically enough, they asked me more about the program, so I sent them some information. So we're going to have further discussion on that to try to improve our workforce also.
What is SAMHSA? Just use it.
Well, SAMHSA, I'll tell you the Substance Abuse and Mental Health Services Administration, federal.
Okay. Federal.
They do our CCBHC, which I'm sure you guys have heard, that grant that we were awarded. So they're part of that initiative. So these are federal, which it's good to see them taking the initiative when it comes to our mental health and what we're facing.
There's definitely a huge need, especially with children and, mental illness all the way through high school. So this is pretty good stuff here.
How do you, from birth to 21, obviously that's before school age and after school age, those ends, how do you, it's not going through the school, it really is, but
Yeah, early intervention. We do have a program here in Chautauqua County, Chautauqua Strong Starts. That's another avenue. We also are involved with the pediatric offices as well. We also have a good relationship with UPMC as well. So we figure we could disseminate it and diversify pretty much on how to help the youth. We are also developing a good relationship with probation as well for those youth as well, who are, hit that cusp 18, 19, 20, and to really try to provide robust services.
I'm sorry, Billy, I think I cut you off.
No, go right ahead.
No, I'm done. That was a good answer. Anything else? Thank you, Carmelo. That's all good stuff. Can't wait. Any time frame on?
We're submitting by Friday, and we'll have our fingers crossed. And as soon as we know, you guys will know. So we are submitting Friday. They've been working digitally. They're working their behinds off and applying for all three. Rachel has been head down on the laptop, typing away, getting everything that we need for all three of them.
Great.
Thank
Thank
you very
you.
much.
Thank you.
Thank you.
For all the work. Do a great job. So, do we have anything for other? Hearing none, do I have a motion to adjourn?
So moved.
Second.
All in favor?
Aye. Thank you,
You're
Mr.
adjourned.
Chairman.
Thank you.
Thank you, Murray.
Didn't screw up that time.
All right.
Good stuff here.
Yeah, I want to have discussions when we can.
Agenda tomorrow.
Yeah.
Okay.
I mean, we spend a lot of time.